Hello and welcome to HD Live. I'm Mabel Jong. Flu season starts in the fall and peaks later in the winter in the US. So what could happen this year when COVID-19 collides with the flu season? How can we protect ourselves, and what impact could this double threat have on the US and the healthcare system this year? To answer these questions, I'm joined now by Dr. Nadia Eltaki, Director of Clinical Operations of the Emergency Department at Sibley Memorial Hospital. Welcome, Dr. Eltaki. It's so great to see you.
Thank you for having me. It's great to be here.
Well, traditionally, the flu season hits around October. How long does it last, and is it particularly challenging this year with the ongoing pandemic?
So in the United States, the flu season typically begins sometime between October and November, peaks anywhere between December and February, and can last until May in the springtime. This year, their COVID pandemic may present some challenges, particularly when it comes to some of the fear that people may have as a result of the pandemic and reluctance to leave their homes to go and get a flu shot. I want to emphasize that doctors and clinics and hospitals have gone through extensive lengths and taken extraordinary measures to ensure that their clinics and hospital and offices are safe places for patients to visit to get their routine immunizations and their health screenings. And the flu shot will be critically important this year to help protect patients, their families, and communities.
Well, thank you for mentioning that, because it does appear that many kids are behind on all their vaccines this year because parents fear taking them to the doctor. Are doctors worried that perhaps parents won't come in to get their flu shot either?
That's the concern that we're facing right now. In fact, when we look at volumes from the past several months since the pandemic began, we have seen a drop off in immunizations, routine hospital visits, appointments, health screens. So that's the primary concern, is that people may have some reluctance to go to the hospital, to a clinic, or to their doctor's office to get an immunization, kids and parents alike.
So let's jump ahead to what can hospital workers, healthcare workers do to encourage patients to come in to get the necessary vaccines, to get their flu shot this season?
I think public outreach is going to be critically important this season. A lot of outreach on behalf of hospitals and clinics and community providers to tell patients and reassure them that their facilities are safe, that they're putting in place proactively measures to ensure the safety of patients and staff, things like pre-appointment screening questionnaires, universal masking of staff and all patients, temperature screens when a patient arrives, and strict disinfecting protocols within the hospitals and clinics in between patients and during patient encounters to ensure that the utmost safety is kept in mind.
Have you seen particular programs, procedures that have been effective? Calling patients, emailing them, reaching out to them proactively to schedule them for a flu shot?
Yes, we have seen that offices are sending out reminders to patients, whether they be mailers, emails, phone call notifications. In fact, major grocery stores and commercial pharmacies are also participating in this massive outreach program, incentivizing flu shots by offering coupons or gift cards in exchange for receiving your flu shot. So really trying to capitalize on the community effort that's required to confer immunity across the board.
Well, people are certainly hearing a lot about the twindemic, the flu season meeting up with COVID-19. Can people be infected by both viruses at once? A super infection, perhaps? And what would that look and feel like?
Unfortunately, it is possible to contract both the influenza virus and the novel coronavirus. And if you are infected with both viruses together, unfortunately, the resulting impact could lead to even more severe outcomes than either infection independently. Unfortunately, the symptoms of both the novel coronavirus and influenza virus are fairly similar. Patients may have fever, runny nose, sore throat, cough, body aches, headaches, GI upset. The single differentiating feature that's we've seen with coronavirus is the loss of smell and taste. That still remains a differentiating feature between the novel coronavirus and influenza. We ask that if you have any of those symptoms, to call your physician, explain your symptoms, self-quarantine until you know exactly what you have, and can undergo testing to that effect.
Could someone who has contracted the COVID-19 or infected by COVID-19 be vulnerable to getting the flu and vice versa?
Yes, I mean, you can contract both viruses simultaneously, and one virus can weaken your immune system enough to make you susceptible to the other virus or any other respiratory virus or illness. Interestingly, what we've seen, particularly in the Southern Hemisphere, is that some of the measures that we're putting in place for the COVID pandemic and some of the behaviors that we've engaged in, including social distancing, universal masking, closures of schools, travel restrictions, working from home, cancellation of large-scale public events, hand hygiene, all of those measures have really proven to be protective in a sense, and may reduce the spread of infectious illnesses like the flu.
Now, despite the availability of a vaccine that addresses seasonal flu, uptake of the flu shot has been historically low. Why is that?
Yeah, I think there are some misconceptions out there. There's the adage that has been circulating for a long time, that if you get the flu shot, you're going to get the flu. That's still a very common misconception that's been percolating on the scenes in the general public. But it's important to note that the flu shot is made from a dead virus. You cannot get the flu from getting the flu shot. However, you can experience some symptoms, which is a result of your body mounting an immune response. So you may have a low-grade fever or body aches, but that's not the flu. That's just your body sort of mounting the appropriate immune response to the flu shot.
And in terms of the vaccine, are there different vaccines for adults than there are for children?
So there are two different types of vaccines. There are two different modalities by which the vaccine can be administered. There's the flu shot, which is the dead virus. And then there's a nasal flu mist, which can be administered through the nose. And more healthcare practitioners are sort of steering away from the nasal mist because of presumed better efficacy of the shot itself. Any child above the age of 6 months should get a flu shot. So 6 months is the cutoff that we use to start initiating flu vaccinations. And it's particularly important for children, for pregnant women, for the elderly and immunocompromised to get their flu shots. But this year in particular, the call is for everyone, if you're able and have no contraindications to getting the shot, to get one.
Is there a best time to get the flu vaccine?
Yes.
Best time of year?
There is. The best time is now. So early September, at the very least, late October is the best time to get your flu shot. And that really allows your body to build up the appropriate immune response in time for the peak prevalence of influenza in the community.
Okay, but what about folks that say maybe if you've gotten it too early, the immunity wears off by the time you hit February, March?
Yes, and that certainly can be a concern sometimes, but the CDC and studies have shown that the influenza vaccine is about 60% effective in preventing the flu. And even though those odds are fair, what we know is that if you do get the flu and you have received the flu shot, the severity, length, intensity, and duration of your symptoms will still be less than the person who has not received a flu shot and gets the flu.
And if kids have gotten COVID-19 and have recovered well, is flu season any different from them this year?
I don't think so. I don't think that that we'll be seeing sort of a second hit effect of the influenza in terms of people who have recovered from COVID and are now ill with a secondary illness. Presumably, they will have recovered from their their previous illness, and hopefully putting all the preventative measures in place to prevent them from getting sick. But I don't think that if there's a contemporaneous, if the infection is several months out from the prior infection, that there are any long-lasting or residual effects from a second hit.
Right. Okay. Dr. Eltaki, thank you. Thank you so much.
Absolutely. It's my pleasure. Get out there and get your flu shot.
All right. I will. Thank you. Dr. Nadia Eltaki from Sibley Memorial Hospital. Great to see her. And thank you for joining us for this session of HD Live, the streaming video service of Health Day News. For more health news, remember to check us out at live.healthday.com, on our Facebook page at Health Day News, and on Twitter at Health Day Tweets. I'm Mabel Jong. Have a safe and healthy day.